Here's a cool story. The pandemic inspired a local couple that works in the healthcare industry to go for something big on their bucket list.
And that something was a trip to Africa for a chance to scale one of the most famous mountains in the world, Mount Kilimanjaro. Senior health correspondent Monica Robbins has a story of a local doctor and nurse practitioner who took their love of climbing to new heights.
Dr. Shubham Gupta and nurse practitioner Kara Richey met 9 years ago at a medical conference.
I asked her to go out for drinks at a biker bar.
They got engaged in 2019.
We were supposed to get married in 2020. Something about a city called Wuhan, and then that didn't happen.
It was literally March, so we sent out our save the dates, and about 3 days later, the world shut down.
Unlike others who postponed pandemic year wedding plans, they had additional stress. Dr. Gupta is a urologist. Richey works in medical oncology. Both see cancer patients at University Hospital's Seidman Cancer Center. They worried about those patients.
While we were less busy, we were preparing for having to go to COVID units and training.
They married last September, but along the way discovered a mutual love of hiking and climbing. So why not climb more than 19,000 feet to the top of Africa's Mount Kilimanjaro?
For us, what we do on a day-to-day basis, taking care of patients, does define us to a very large degree. And just a recognition of that, and also a way to honor our patients.
We just never wanted to wait to do something that we've wanted to do. Our bucket list tends to just get scratched off and added to rather than piled up because of our life outlook.
4.5 days up in the cold, battling altitude changes, relying on each other. The summit hike took 7 hours in the middle of the night, one slow step at a time.
That trip up was brutal, but getting up there, you are so tired, you cannot breathe, you can barely see. But then you see the sunrise and you see that you're at the top. It's phenomenal.
At the top, they honored their patients and their calling with a Seidman Cancer Center flag.
And I'm sure we, carry around the patients that we've cared for and, kind of feel like at least in some way that we do a lot of what we do as far as achievement-wise for them in some way. And so I think part of that was a really big reason for taking the Seidman flag up there.
Life is short, and we have a lot of responsibilities on a day-to-day basis, but our thought is that you have to seize the moment.
Monica Robbins, 3 News.